Thank you so much, Dr. Chowdhury, for that very kind introduction. Today, I just want to share a little bit about what it's been like to be on the front lines of fighting the COVID pandemic here in our county and just take you through a brief history. So this is just a brief history of how we have experienced and how I and our department have experienced the pandemic right here in Santa Clara County. So I'm just going to touch on a few things. One is a very abbreviated history and a little bit about my role. Then I'll talk a little bit about the COVID vaccine rollout. And finally, a few thoughts on what's next. And then I know that we'll have a nice Q&A and we can probably talk a little bit more about that at that time. So when I think about the local pandemic, I think about it in three parts. So I just have 3 slides to talk about what the experience has been like. And sometimes there's been so much that's happened in the last year, it's hard to remember what it felt like in February 2020. Maybe many of you remember what you were doing in February 2020. I know I do. It was actually a few days before my very first press conference where I became an international meme and embarrassed my teenagers. I remember that about a year ago. I also remember that about a year ago, we felt quite blind. We didn't know what was going on because at that time, we had so few tools available. And most importantly, we didn't have much in the way of lab testing. And I picked out some data to share with you from some notes I had from just a year ago, what things looked like on February 4th here in our county. So very beginning, you haven't even you don't even see the cases rising on that epidemic curve. But at that time, we were sending all of our specimens to the Centers for Disease Control, and a few of them were coming back positive. So on February 4th, 2020, Santa Clara County had 2 of the 11 positives in the entire country. So we had 20% of the positives, but we were only submitting 5% of the specimens. So something didn't feel right, and we had the sense that we were indeed different in the county. Of course, the minute we began testing, we began finding, and it became very apparent, very clearly, every signal that we saw showed us that we were in trouble. And you can see that very steep rise in the beginning of March that led to the first shelter-in-place order, where I, along with colleagues around the Bay Area, we issued identical orders on the same day. What followed after that, in retrospect, that was the easiest part of the pandemic. It was very clean. We had few tools available to us, so we simply had to use the tools that we had. It has become increasingly more complex since that time. And it started to become complex as soon as things settled down, because then the clamor to open things up and to resume normal life started to become rather loud. So part 2, let me go back here, apologize. Part 2 is the second surge, the summer surge, but I wanted to share it with you in the context of the spring surge, which in this slide looks like nothing, and the winter surge, which in this slide looks as it was, as we experienced it, very dramatic. But what was happening during the summer was a number of things. We were actually still trying to build the guardrails to protect everyone in the population, and chief among those, one was to scale testing to make it really easy for anyone to get a test anytime, and the other is to scale contact tracing. So each time we found someone who was positive and infectious and could potentially spread to others, we wanted to have a high-touch effort to reach them and discover all of their contacts. And it took time to build that infrastructure. As you all remember, while we're building that infrastructure, the pressure and the discourse to do something different and to open things up was rather intense. And it was also complicated because the coalition across the Bay Area didn't hold. We were together across many of our values and ideas, but not precisely about how we were regulating. I just wanted to talk about two really important goals that we had at that time as we were building the infrastructure and during the summer. One was we tried everything that we could think of, along with many other jurisdictions, to protect vulnerable communities. Everyone living in a long-term care facility, we were seeing disproportionate illness, hospitalization, and death among long-term care facility residents. We stood up very large teams with lots of efforts to help protect residents, and we still had outbreaks. Second, we were extraordinarily concerned, really starting in late March. We started to see patterns with disproportionate illness, hospitalization, and death in particular communities in our county, mostly in East San Jose and in Gilroy. And there's very, very difficult to protect people who are frontline workers, who are living in multi-generational homes and often in crowded homes. Very difficult to protect people other than keeping the overall rate of transmission low. And so that is what we were trying to do during the summer, and indeed are still trying to do. We were also at work in the summer with plans and working with schools to understand how we could open schools as quickly as possible. As you know, some schools are open for in-person learning, however, most schools are not. Really, the part three of the pandemic has been the devastating winter surge. And it's difficult perhaps to see on this slide, but we had reached a bit of a balance in the fall. The rates were still high, but they were stable. So we had quite a bit open, quite a bit of our cherished activities had resumed, and our rates were pretty stable, and it felt like we were in a steady state. And then on November 3rd, we just took this sharp turn and our cases started climbing, and they started climbing rapidly, and they continued to do so until early January. And then right there on January 8th, they turned and have begun declining and declining rather quickly. Over this time, it's a little difficult to see in this slide, but on the bottom, you can see in the yellow and the orange, those are residents and staff of long-term care facilities. And the pattern that we have seen again and again and again is that as the cases rise in the community, it becomes more and more difficult to protect people in long-term care facilities. And we saw many, many outbreaks and many, many deaths. And as of now, a year in, over 1,700 people in our county have died of COVID. Many of them elderly, but not all. And this is something that's very, very difficult to even. It's difficult to even think about, to be honest. So many families have experienced so much sadness and so much loss, and not just of course from losing someone to COVID, but from illness and from the anxiety of the pandemic. It's been enormously challenging. The beauty, though, of this is that who would have guessed that less than a year into a pandemic, we would have not just one, but two safe and effective vaccines, and those began rolling out. I think it was either December 17th or 18th in our county, so before the year's end. So just a couple of core themes and challenges as I reflect on the last year. First, everything is unprecedented. So there are a few people perhaps living in our county who lived through the last great pandemic, the 1918 flu, but not many. So for all of us, pretty much everything is unprecedented. The ways in which we've needed to respond have also been unprecedented and extraordinarily difficult and extraordinarily uncomfortable, which brings me to my second core theme, which is that most of the choices that I've needed to make and that we've needed to make, the choices have been between very bad options. None of the options are attractive in any form or fashion, but choices have to be made. one of the ways in which our county has been unique and distinct from other jurisdictions across the state and the country is that we have tried very hard to have a uniform approach. So we are thinking about, as we're learning about how COVID is transmitted, and as we now know, much of it is aerosol and airborne, a bit of it droplet and very little on surface. We just have to think about outside being safer than inside, wearing a mask being protective, people both wearing masks, very protective, et cetera. So try to pick between industries or activities, but rather think about what can be done outdoors, what can be done wearing a mask, and what can't, and then apply it uniformly across. Lots of details, and we could talk about that for a very long time, but that's sort of the central way that we've made decisions in the face of very bad options. And third, I would say, we all talk about building a plane while flying and how difficult it is, but responding to this pandemic has really felt like building a whole fleet while trying to form them in formation. There's been so much infrastructure that's needed to be built, like just-in-time infrastructure, because the truth is has been revealed is that the public health infrastructure that's needed simply doesn't exist. We don't have the data systems. We don't have the trained workforce that we need. And I'm not talking about our county as much as I'm talking about across the state and across the country. And it's been extraordinarily difficult to do our work in the county when that infrastructure simply doesn't exist at the state and federal level. So, the wonderful part about this pandemic, of course, if there could be anything wonderful in such a devastating and deadly pandemic, is that we have a safe and effective vaccine, two of them, and I think soon we'll have three and perhaps more. But the rollout has been challenging. And I just wanted to highlight a few themes about the vaccine rollout to share. First is that at the local level, it's been very hard because the state and federal guidance has been changing pretty much continually. So just as we think we have the hang of what the rules are and what the parameters are, then they shift, and then we need to readjust both our operations and our communications. And this has happened again and again and again. So that's been challenging. Second is, I would say that at this point, we still have a huge mismatch between supply and demand, and that the vaccine supply remains our number one limiting factor in getting vaccine out to everyone who needs it. Third is we have two imperatives. One is to go fast. The more people that we can vaccinate and the faster we can vaccinate them, the faster we can reach herd immunity. And it's extraordinarily important, in fact, it's central to our work, that we do so in an equitable fashion. We know from our data, and I'll share just a little bit with you in a moment, about where we have had the highest rates of infection, the highest positivity rates. We know these communities, and these are the communities where we need the vaccine to roll out the fastest. These are also communities for many reasons that are difficult to reach, and there's a number of barriers to vaccination. And so those efforts are a little bit, they're resource intensive, they're high touch, and they're not fast. So we have built a number of strategies so that we can both focus on equity and go fast. And then finally, I would say that the allocation has been challenging, and I think that's going to change. So for the next 2 weeks, it's our department's responsibility to allocate to providers, and in mid-March, the state has a third-party administrator, Blue Shield, who will be then responsible for allocation. So this is a snapshot from our vaccine dashboard, one of many dashboards that we have. And this is a little bit outdated already. I think we're up to close to 53% of people over 65 having received at least one dose of vaccine. And this is pretty good because we didn't even start vaccinating 65 and up until January 26th. So it's been less than a month, and we're over halfway, which is wonderful. Here, I just wanted to share, this is again from a dashboard on our website. The dark blue shows census tracts that are, this is part of the Healthy Places Index, which essentially is a composite to show the social determinants of health and the census tracts that are going to be at greater risk of poor health outcomes. They map pretty well to where we've had the highest rates of COVID and hospitalization. And you can see in red where we have our county vaccination sites. So we are in community where we need to be. This is our website, secfreevax.org, that links to all the information about vaccination, as well as vaccinators across the county, both us vaccinating at the county as well as our partner healthcare systems. So in closing, just reflecting a little bit about what's next, here are some questions that I think about. One is, when will we flip where the vaccine supply exceeds the demand? I hope that happens soon. Don't know when that will be. And related to that is, when we'll be able to ease all of these, what we call NPIs, or non-pharmaceutical interventions that we're all doing to keep ourselves safe. When will we have enough of the population vaccinated that we can ease up? What will the new variants that are emerging, will they emerge faster than we can vaccinate, or can we vaccinate faster than the variants overtake us? And then a broader question, I think, is how has this pandemic changed the way we live, and which of these changes will be permanent, and which parts of our life that are dear to us will we be able to return to? And then I think just the final two is, we have learned a lot, and I think that it's on us to redouble our commitment to equity and to being certain that what we have seen in this pandemic and how it has revealed the systemic inequities, we need to redouble our effort to address those inequities now and going forward. We will have another pandemic. It's inevitable, and I hope we do a better job next time. So that is the end of my presentation, and I am really looking forward to a little Q&A. Thanks so much.
Dr. Cody, thank you. We feel so grateful that you would join us. We know you have incredibly intense demands on your time, so thank you for carving up some time out for us. I got to be in an audience one time with Captain Solenberger. You know, the guy, he was the one who landed a jet on the and I remember him saying in his remarks that when that moment arrived, he just kicked into a form of autopilot. In other words, he made the statement, I just did all the things that I had been trained to do. Mm-hmm. Is that how you feel?
Sometimes I think I've never flown a plane, but I actually have thought of, really from watching movies, about that feeling of what a pilot must feel like when a plane is about to crash, and that you just have to withstand all of that shaking and all of that chaos, and keep from crashing the plane. And I would say that guiding the local pandemic has felt a bit like that. That it's felt chaotic and dangerous, and that we have to make decisions and act very quickly, but we don't have any choice but to make the decision and to do it, and just to endure the keep the plane from crashing. Yeah, a longer time horizon than a crashing plane, though. It's been much longer time horizon.
I think the point that that the captain was making was that you can train for these things,
Mm-hmm.
and you actually know what you're doing. And I think that's the case with you. You've spent a career thinking about pandemics, their possibility, and then what the response should be. So when it finally arrived here, I'm just curious about your observations for the rollout. Did it go as you would have expected? Were you caught by surprise? And if you had a do-over, are there things you would do differently?
So I remember very clearly the conversations and the decisions that led up to the shelter in place. I remember that extraordinarily clearly. And in many ways, that was where I felt like all of the experience that I had gathered in public health, I could feel it and I could make that decision with confidence. And part of that decision was this. It was rather simple in that we know how infections behave, we know what exponential growth looks like, and we knew that we had very few options. And so the option to shelter in place was a drastic option, but it was eventually going to happen. If we were just looking at what was happening in other parts of the world, that was what we were going to get to. And we had the data in Santa Clara County to show us that that was the path we were on. Even if we couldn't see all of it, that was the path we were on. And so the decision was really do it quickly, and we would know that we would prevent more death. We also knew that it was going to be incredibly disruptive. However, wait a day, wait a week, same incredible disruption and much less benefit. So once we realized that that was what we needed to do, there was not even no reason to wait, but there was a real urgency to do it. So that was strangely it was a difficult decision, but more comfortable. Many of the decisions that have come after that have been much more challenging, much more complicated.
I'm sure I can't even imagine.
Yeah.
Dr. Cody, you are an unelected public servant, and yet you have extraordinary authority. However, your authority is limited. You have to work in partnership with elected officials who are the ones who would finally issue decisions, such as closing down sectors of the economy. So without talking out of school, just can you tell me what that interface has been like for you with elected officials?
Well, I think it's not just interface with elected officials, but it's interface with many, with many. I think this wasn't apparent or not well known, but in California, actually, the laws are very clear, and they give the California laws give very specific authority to health officers. And so there are decisions that I have the responsibility to make, and it's, I think, by design separate from elected officials. But elected officials, hear from their constituents, and we serve the same public, and we have the same interests. So I think, it's been, I would say it's been a dance. Mm-hmm.
Very nice. Okay, now you have, of course, stewardship for one county, Santa Clara County. But what if your stewardship were the nation? How would you advise our national leaders? How do you feel about the course that our nation is now taking?
So I think that we are back on a more traditional track for public health, where we get regular communication and leadership from the Centers for Disease Control and from other public health leaders. I must say that during the course of the pandemic, one of the central challenges was that we were not seeing much leadership coming from the federal level. It was pushed out for the states. Every state had different decisions. And then in many ways, the states pushed those decisions out to the locals. So we had a pretty chaotic patchwork. And for an infectious disease like COVID, that doesn't work out very well. So I think that if we had a do-over for the pandemic, I think that the federal leadership is just critically important. For a pandemic, you must have federal leadership. There's only so much we can do at the local level.
Doctor, you have said many times and in print that we should not be thinking that we can never go back to the way things were. Don't be wishing you can go back to 2019. You have said that. I want to explore a little more what you mean by that. Seriously, we'll never gather in the way that we used to?
Well, I think I am so heartened by the vaccine and the data that's coming out about the vaccine. We know that it's extraordinary. The vaccines are so effective in preventing symptomatic illness, hospitalization, and death, which is fantastic. And we're now beginning to see some data emerge that the vaccine prevents people from spreading as well. Those data are incomplete, but we're getting there. So this is not something, in the fall, we didn't have the vaccine. The vaccine hadn't been rolled out. So this is quite different. I think that I don't know, but I suspect it will be quite a long time before we have large gatherings. I hope that in fairly short order, we will see our children back in school for in-person learning. I hope that we will be able to reach everyone who needs to be vaccinated and get them vaccinated. That's everyone 16 and up. Have enough supply and really reach everybody. And then I think that we do have a chance to return to a normal. But this has been like a national trauma. We're not going to be the same. We've been through a national trauma. So it's
further on the vaccine. There are new variants, including one that's just reared its head in our county, and it's said to be more deadly. Do I have that right? And will the vaccine be efficacious?
So there are 3 variants that have been called variants of concern. The UK variant, as it's called, which is much more transmissible. A variant from Brazil, which we've not seen yet here, and then the South African variant, which may not work as, some vaccines may not work as well. So in California, we've had the UK and the South African. The variant that I think you're talking about is one that's circulating in California, and I think there are data emerging, but I think it's a little too early to tell how it's going to behave. So we know that we have quite a bit of this variant in our county, but for example, when you look at the epidemic curve that I showed, if the variant is gaining and if it's really that more transmissible, it's a little bit difficult to explain our cases that have dropped off dramatically. So I think the truth is we don't quite understand how all these things are coming together. Yeah.
So we have to stay tuned. Still on the subject of the vaccine, though, you said how important it is to roll it out and quickly.
Yep.
Is there anything we're not doing that you see that we should be doing?
Well, from my kind of simpleton perspective, the operations of vaccination and scaling from both mass vac sites like we have at Levi Stadium down to very small pop-up sites that our public health department is doing in certain communities. Every time the rules change, we have to sort of rejigger how we do it. So if we could just kind of stick with the same set of operating parameters, that would be enormously helpful. And even just from a planning perspective, at the local level, we just hear once a week how many doses of vaccine are coming in to our providers, and it would be optimal to have a longer planning horizon so that we could make sure that we're on top of everything.
Great. Doctor, we actually have a chat window and people have been posting questions. I'm going to pull a couple of them.
Okay.
one set of questions was asking about people like mail carriers and delivery people, and why wouldn't they be higher in the queue for the vaccination? And then there was a similar question for people working on transit workers.
Okay, so the guidance that we are following in our county and across the state is the guidance from the state, which has the vaccines rolled out in phases. So I think the question is, why are those particular groups not in phase 1B, tier 1?
Right.
And I think it's so right now we're, next week we'll switch to educators and childcare workers, food and ag, and emergency services. And we've not yet heard the groups that will be following that. So in relation to the questions in the chat, I don't know when those groups will come, but they don't quite fit under those three big groups.
I see. I think we're actually almost out of time, so I'm going to make this my last question. And I actually want to make it a personal question, if you're comfortable, which is, we just want to know, what has this journey been like for you? We're aware that you're facing things like death threats and that you have to have a security detail, and I'm just imagining it has to have been incredibly difficult for you and your family. Am I off base?
You're right on target. No, it's been a very challenging year. That's the truth. But I think it's been a very challenging year for everyone in our community. I mean, I've not lost a family member to COVID. Many people have lost a family member to COVID. I'm employed. Many people are not employed. So I mean, I think that I think it's been a very difficult year for everyone, and it's been a difficult year for me as well. But
Dr.
we're
Cody,
all in it together.
Yes, thank you. I can't speak for everybody, but I can speak on behalf of my organization. And on behalf of Joint Venture Silicon Valley, I would like to say that we consider you a hero. We're so grateful for your leadership and for your courage. Thank you.
Thank you so much. Thank you for having me.